Good afternoon, everybody. I appreciate you taking the time out of your day today to join us for this webinar called Starting the Medicare Conversation. It will present some important talking points and concepts to help you initiate this important conversation with your clients and prospects. Before we begin, I do want to let you know that there is an opportunity for questions and answers. To ask a question, just simply type it into the GoToWebinar control panel that you see there on your computer screen. Of the 10,000 baby boomers turning 65 every day in our country, many may be your clients who have come to trust you for other important insurance and financial matters. They trust you for some of the most important matters like homeowners, auto insurance, or investments. And now with Medicare's enrollment period just around the corner, beginning October 15th and lasting until December 7th, these clients need to know that they can turn to you for their Medicare guidance and answers. It's very important that we as advisors need to move our focus from helping clients accumulate their wealth to helping them preserve and protect it. It's important to educate your clients on the cost of healthcare in their retirement years. The Center for Medicare and Medicaid Services estimates that Medicare's total annual cost for people in good health is $7,620 in 2017. Those who have chronic conditions like diabetes or heart conditions can expect to pay much more, as much as $12,000 more per year. It's important to ask your clients questions like and advise them that you can help them provide protection against these high out-of-pocket costs. The 2007 retirement survey from Merrill Lynch, in conjunction with AveWave, states that if a married couple wants to have at least 90% certainty that they can cover their out-of-pocket health-related expenses in retirement, they'll need $259,000, more than the average home equity, and more than the median household net worth of Americans 65 and older. And that figure, it's important to understand that that figure does not include long-term care coverage. Only 37% of people think that they'll need long-term care. Yet in reality, 70% will need it at some point in their lifetime, on an average lasting 3 years. This same study found that many pre-retirees struggle to get a handle on their health care costs because information on costs can be complex and confusing. Many want advice about Medicare and supplemental plans. They want advice on long-term care and how much money they need to cover these costs in their retirement. Yet very few, less than 15%, feel that they have a trusted source to help them understand, prepare for, or manage retirement health-related expenses. Further, some 70% of married pre-retirees have not even discussed with their spouses health care in retirement and how to pay for it. If nothing else during this presentation, please take away the fact that less than 15% of those nearing retirement feel that they have a trusted source. And this presentation will help you gain some knowledge on how you can be that trusted source to these people and provide value to your business. To begin the Medicare conversation, you likely know your client's age, but you may be unsure if they have coverage or not. You can ask them questions like, in regards to your health coverage, are you self-insured? Do you have a Medicare Advantage plan or a Medicare supplement? If your client already has coverage, you can say, if I may review your costs, I may be able to save you money without losing any benefits. If you're not sure of the coverage that your client has, mention something like, I can help lessen your burden of determining the health coverage you need. and guide you in choosing the Medicare coverage that best meets your needs. In many situations, your focus may be in financial planning, where you've provided life insurance or maybe even an annuity to your clients. Who do you want advising your clients on their healthcare costs? It's important to inquire on their healthcare needs and don't risk losing this business. Be sure to make Medicare a full part of the financial picture. In many situations, you will know their financial picture, but it's important to inquire a little bit further to find out what they have and what they spend for health insurance coverage. Let's see if I can lower your health insurance premiums is a strong statement to mention to your clients. When talking to your clients about their healthcare costs in their retirement years, it's important that you understand the Medicare options. When one turns 65 and is on Medicare, there are two options available to help them pay for Medicare's out-of-pocket expenses: Medicare supplements and Medicare Advantage plans. Medicare supplement plans, also known as Medigap, pay for the gaps, the copays, the deductibles, and coinsurances in original Medicare Parts A and B. It's very important to point out to your clients that if they were to just stay on original Medicare Parts A and B and not get a Medicare supplement plan, they would have to pay the $1,316 deductible for Medicare Part A, or their hospital coverage for admittance into a hospital. Most Medicare supplement plans, including the two most sold plans, plans F and G, pay for this deductible. This alone justifies the cost of any Medicare supplement plan. Medicare supplement plans are affordable premiums with no network restrictions. They have little to no out-of-pocket exposure and are standardized benefits, meaning the benefits with one carrier are the same with another carrier. And in order to sell a Medicare supplement plan, agents do not need to be certified with most carriers. I believe AARP Medicare supplement is the only MedSup off having to certify for. When enrolling into Medicare, there are certain times when you can enroll. The open enrollment period is a 6-month period that begins the first of the month that one has Medicare Part B and is at least age 65. During this period, carriers are required to issue any Medicare supplement plan applied for. If one is past their open enrollment period, they may still have an opportunity to receive Medicare supplement coverage without having to answer any health questions if they qualify for a guaranteed issue scenario. The most common scenario being an involuntary loss of credible group coverage that was primary to Medicare. In this situation, when that occurs, the beneficiary has an opportunity to purchase Medicare supplement plans A, B, C, F, K, or L without having to answer any of the health questions. You'll recognize that Plan G is not available in a guaranteed issue situation. Other guaranteed issue scenarios are specific to losing Medicare Advantage coverage, where that person on a Medicare Advantage plan had a trial right where they're in that plan for less than 1 year, and they may be able to go back to their original Medicare supplement if they were previously on a Medicare supplement plan, or go to another Medicare supplement plan if it was their first time on in Medicare Advantage. If you have more specific questions regarding these scenarios, please be sure to let us know. Further, it's important to understand that insurance carriers can often pay a lower commission for guaranteed issue business. Medicare Advantage plans, or Part C as they're referred to, are combined Parts A and Part B benefits. A Medicare health plan is a plan offered by private companies that contract with Medicare to provide Part A and Part B benefits to people with Medicare who enroll in the plan. Medicare health plans include all Medicare Advantage plans, Medicare cost plans, and PACE plans, which are programs for all-inclusive care for the elderly. Further, Medicare Advantage plans can include HMO and PPO plans and private fee-for-service plans in more rural communities. There's special needs plans and Medicare medical savings accounts. Most Medicare Advantage plans offer prescription drug coverage, but some do not. And they require policyholders to pay the Part A and B premiums. Medicare Advantage plans cost $0 to a modest premium in exchange for higher out-of-pocket costs. The deductibles, co-pays, and co-insurances that are capped anywhere from $3,400 to $6,700 per year. Some Medicare Advantage plans include benefits that are not part of original Medicare. Medicare Advantage plans, in order to be sold, agents must be certified to sell them. When enrolling into a Medicare Advantage plan, you can enroll during one's initial election period, which is 3 months before the 65th birthday, the month of, and up to 3 months after. There's the annual open enrollment period that we're hearing a lot about right now in the industry. That period is October 15th through December 7th, when existing beneficiaries can enroll into a new plan, disenroll from their current plan, or make changes to their Medicare Advantage or prescription drug plans. There's also several special election periods, the most common one being a loss of employer group, in which case, when someone loses their group coverage, they have 60 days from that date that coverage ends to enroll into a Medicare Advantage plan. There are several other scenarios that qualify for special election enrollments as well. And there's also the Medicare Advantage disenrollment period of January 1st through February 14th of each year. During this period, Medicare Advantage beneficiaries can leave their Medicare Advantage plan and go back to original Medicare, get a standalone prescription drug plan, and apply for a Medicare supplement. It's important to understand that the enrollment into the Medicare supplement plan is not guaranteed and will likely have to go through medical underwriting. So be sure to never advise your clients to disenroll from a Medicare Advantage plan until they know that they have approval to get into a Medicare supplement. Part D, or is referred to as a prescription drug coverage, offered by private insurance carriers for a premium. Drugs are broken down and categorized into certain tiers, and each tier has a corresponding copay. Medicare prescription drug plans are available as standalone plans or can be combined with Medicare Advantage plans. The enrollment options for prescription drug coverage are the same as, very similar to Medicare Advantage. There's your initial election period, the open enrollment period, and special election periods also do apply. When you talk to your clients about lowering their healthcare costs and advising them on other important insurance coverage that meets their specific needs, you create raving fans. Your customers are only satisfied because their expectations are so low and because no one else is doing better. Just having satisfied customers isn't good enough anymore. If you really want a booming business, you have to create raving fans. Now just take a moment to think about that and imagine that your clients are so pleased by the services that you offer, the coverage that you have provided them, that they become raving fans. Raving fans tell their friends and their family about your services and what you have provided for them, and how you have helped them secure important insurance coverage. Raving fans are your number one lead source. Now, how do you go about creating those raving fans, and how do you go about further talking to your clients about Medicare and how you can lower their health care costs. It's important to understand that Medicare and senior health market is all about a trust sale. And you need to build upon the trust that you've already established with your clients. As I discussed earlier in that survey from Merrill Lynch, it is evident that seniors are clamoring for guidance on their Medicare choices. So it's important that you be sure to offer guidance on the best options for them. You don't need to be an expert. You just need to know the basics. You can always rely on us at Art Jetter & Company for the expert answers and guidance. Also, it's recommended to not pigeonhole your marketing to people turning 65. The 40-year-old client who trusts you for all his life or P&C needs will certainly want to refer you to his parents or loved ones for Medicare guidance. Again, when you do this, you create raving fans. These concepts will help you add value to your business. Property and casualty carriers and their agents have really done a great job of mastering the bundle concept, where they provide home, auto, boat insurance, and now they're even incorporating life insurance. And some are beginning to incorporate Medicare. But it's important to really enhance their business and really talk to your clients about their healthcare costs as they approach retirement and nearing 65. When agents market Medicare services to their clients, it can help ease burdens to those turning 65 or nearing retirement. Medicare beneficiaries all too often receive information from television commercials that advise them to call an 800 number, where they speak to a live representative about affordable Medicare coverage. The person they speak with just sells them a plan. They certainly aren't advising them of the best, most affordable options, and certainly don't have your client's best interest at heart. You need to be the one to tell your clients that you are the one who can advise them on their healthcare costs, and that you can recommend the most affordable and reliable coverage that will meet their specific needs. Recently, I heard of a story where a 70-year-old woman approached her agent, who had previously sold her some home and auto insurance several years ago, and this woman asked him about Medicare supplements. She had seen the advertised rate for a Medicare supplement on TV and asked her agent if he could help her. This agent certainly did a great job of building loyalty among his clients. This person knew that she could go trust him to ask questions about other coverage. But since he didn't advise her that he could be the one to help her with her Medicare when she was 65, this woman is now not able to get a Medicare supplement plan due to health conditions that prevent her from passing underwriting. Had this agent told her he could advise her of her Medicare coverage, this could have been a much different outcome and produced an even more vocal, more loyal, and more dedicated raving fan. When talking to your clients about Medicare, it's important to understand that Medicare doesn't pay for everything, and that you need to further ask even the right questions, like, how do you pay for dental care? Could you use some extra cash to cover a hospital stay? What happens if you get cancer? Are you insured in the event that you would be confined to a facility? These are common needs amongst seniors. And a senior dental policy, cancer coverage, or hospital indemnity plan can provide these needed benefits. Just asking these simple questions can strengthen the relationship you have with your client, lead to more sales, and put more money in your pockets. Each time you don't ask these questions, you are leaving money on the table. Just simply asking these questions can lead to a sale 50% of the time. Here you see an illustration about the money that can be made selling just Medicare supplement plans. Medicare supplement plans offer commissions that are level commissions for 6 years and a renewal stream years 7 through 10 in most situations. This illustration shows an example of commissions paying 20%. Carriers are paying at least 20% commission. The street level is usually higher than that. This earnings example shows one sale per week for 6 years, and it's helpful to understand the compound effect. You earn your commission each year for your new business sales. So beginning in year 2, you earn your new business commission plus your renewal commission on existing business. And you will see that just by selling one Medicare supplement a week, that in 6 years, you're making more than $90,000 just on Medicare supplement business. Once your client knows the importance of purchasing a Medicare supplement, you can turn the conversation towards the specific carrier and start to seal the deal. You can focus on brand recognition amongst the carrier, the financial strength of the carrier, and the superior customer service that it provides. You need to ensure a smooth business transaction. Submitting the application is a smooth process, and it can be submitted when it's submitted electronically. Electronic applications are often issued within minutes, and many carriers even offer a temporary insurance ID card that can be emailed to your applicant. Certain carriers that offer multiple products make it incredibly simple for you to offer your clients additional products like dental coverage with just a simple click when using their electronic enrollment process. So it really gives you an opportunity to offer your clients a package deal to provide them with more coverage that they need. And this will help increase the persistency of your business and, again, add more value to your client relationships. The Medicare conversation is not a difficult conversation to start. Knowing the basics of when to enroll, some of the options available, and what Medicare covers is extremely valuable. And remember to understand that the benefits of a Medicare supplement plan, like plans F or G, are the same regardless of the carrier, further simplifying the sale of Medicare supplements. This makes it simple for you to demonstrate the benefits a Medicare supplement provides. And when you don't know the answers, simply just call again on us here at Art Jetter and Company. At Art Jetter and Company, reminder that we are specialists. We are life, health, disability, critical illness, annuities, long-term care, linked life and annuities, a brokerage general agency, where we are specialists in our own respective markets. We here in the senior health team, with a team of 4, can answer all your questions about Medicare. Our contracting manager can help you out in submitting your contracts to the carriers in a timely manner. And if you submit a paper application, our new business team does a tremendous job of processing and providing status on all your applications that you submit. If you have a specific question regarding medical underwriting, our chief underwriter on staff, who has more than 30 years of experience in morbidity and mortality underwriting, can advise you. Further, we have great incentive programs and lead programs here at Art Jetter and Company. We provide 100 free names of people turning 65 when you become appointed with our Medicare supplement carriers, and also for issued business. It provides 200 names for an issued e-app and 100 for a paper app. We have strong relationships with many lead vendors, and the carriers have excellent lead programs as well, and we will help you take advantage of these opportunities. One of the most important tools that we offer for our Medicare supplement agents is our Medicare supplement quote engine that provides our appointed Medicare supplement agents the ability to shop the market for the most affordable options for your clients and provide them customized quotes. The quote you will provide will include more than just the rate, but an outline of the benefits each plan provides, and other important information like the carrier's experience and AM Best rating. You can request access by visiting our website at jetter.com and clicking Medicare or MedSup quote. I want to thank you again for listening on in this presentation, and remind you too, if you do have any questions, please type those into the box you see there. One of the questions that I've received says that this particular producer has come across people who don't have a positive view of Medicare or Medicare supplements, and how can you change the tone? One of the ways to change people's view of Medicare, to help them not let them think that it is an overwhelming or a complex process, is to simply really simplify it for them. I think it's important to understand the main means of a Medicare supplement plan that pays for the co-insurances or co-pays that are left by original Medicare. So going back to the previous example, the Medicare Part A hospital deductible, they just go to the hospital, they pay $1,316 out of their own pocket. But a Medicare supplement plan will pay that $1,316 deductible. So, and Medicare supplement premiums anywhere from $1,200 to $1,500, $1,600, depending on the area in which you live in the carrier. You can see right then and there that the value of a Medicare supplement plan, that if it pays a minimum amount of premium, pays for that $1,316 Part A deductible. Not many people can afford that right out of their pocket if they were to have a hospital, an inpatient hospital stay. Again, if anybody else has any further questions, you can type those into the box, and I'll be sure to answer those. But I also want to let you know that with the upcoming Medicare enrollment season coming in less than 2 months, we do have an excellent program here, and I want to make sure that you take advantage of that, where we can provide you with customized calling lists of people who are turning 65 in your area, or not even turning 65. You can choose the age that you want. If you want people 68, 70 years old, we'll be glad to provide that for you, to really customize it to meet your specific needs. In terms of the carriers that we represent, we have a strong portfolio of carriers. Mostly our number one primary carrier is Mutual of Omaha, and Cigna, Aetna, Transamerica, AARP, and Medico are our top carriers that we offer at Art Jetter & Company. And regarding prescription drugs, SilverScript, you'll see information next week that we'll send out about SilverScript's prescription drug plans, along with AARP, United Healthcare, and Aetna for Medicare Advantage. So we really have all of your needs met here to help you have a successful upcoming enrollment season. We can look forward to working with you, having you get appointed and submitting business. So I believe that's all the questions that were asked, and I've addressed those. So if anybody has any further questions, please feel free to email us at seniorhealth@jetter.com or calling us at 800-228-0008. Thanks so much, everybody. Hope you have a wonderful day and a successful selling season.